Good afternoon and welcome. Thank you so much for joining us today. We're just letting people in from the waiting room. But today, we thank you for joining us for a consumer town hall on long-term care facility visitation updates. With us today, we have Tony Chicotel, our CANHR staff attorney. And Tony, I'll turn it over to you for an introduction of the other speakers.
Yeah, hi everyone, good afternoon. Thanks for joining us. Along with me as a speaker, I've got some representatives, some founders of the Essential Caregiver Coalition who are going to supply some color commentary as I go through the slides. That's Madeley Weissman, Melody Taylor Stark, and Miko Cook. So thank you to all of you, the 3 M's for joining. First of all, I got to say, I'm not sure that this shirt is working for me today. This is a shirt I got from Costco, and I see myself on the screen, and I don't know. I'm not sure it's really working or not. Future Zooms, maybe I'll go with a different shirt. But aside from that, I'm excited today. I feel like this is the first visitation town hall / webinar we've done since 2020, where I feel like I'm on solid footing for understanding where we are. There's been a lot of developments in the since 2022, and I feel like there is some stabilizing happening. I hope that that's the perception in the community, that we're getting back to more visitation. I'm sure that there's problems, and I'll talk about dealing with problems, but I'm excited to get into the slides and explain where I think we are, because I'm pretty confident that that is in fact where we are, at least with the rules. All right, so just sort of a preliminary. Oh, and I want to mention, this is a webinar. We're not going to do live questions where people are unmuted and they can speak their questions. If you do have any questions, please put them in the chat, and we'll try to get to them at some point during the presentation. So as a preliminary matter, I want to talk about who's making the rules, because there's been a ton of confusion about this, and I'm not sure that I've ever addressed it sort of comprehensively in the informational settings that we've had in the past. So there's 3 levels of government going on here, which is unique for long-term care, where in some regards, counties have never been involved in long-term care, but with the pandemic and COVID-19, they have been. So CMS is the federal government. That is the federal agency that regulates nursing homes. It stands for the Centers for Medicare and Medicaid Services. The federal level has a great deal of regulatory operational control over nursing homes that receive federal funding, and virtually every nursing home in the country receives some, and in most cases, a lot of federal funding. CMS does not have, for the most part, CMS has no role in assisted living facilities. So there's no federal rules about assisted living anything related to assisted living for the most part, and definitely not on visitation rules. So CMS is federal, and it's just a nursing home oversight agency for our purposes. On the state side, you have CDPH and CDSS. That's the California Department of Public Health and the California Department of Social Services. CDPH regulates nursing homes for the state, and CDSS, Department of Social Services, regulates assisted living facilities in California. On the visitation issues, since pretty early on in the pandemic, I think the shots about visitation are being called by CDPH, and CDSS is just adopting and deferring to the DPH rules on nursing homes. So you see very little differences between the state nursing home rules on visitation and the state assisted living rules on visitation. And then we have the counties, who have been, some of them, very active in creating visitation policies and restrictions in their communities, coming from their public health authority. So who makes the rules? The short answer is all of them do. The federal government has control over the state, because in addition to paying nursing homes, CMS also pays the state of California to act as its agent in enforcing the federal rules. So At the federal level, there's very little direct enforcement where federal employees go to nursing homes and do nursing home oversight. Instead, they pay the state. They give the state billions of dollars every year. Well, I'm sorry, probably not billions, but for nursing home oversight, it's probably millions of dollars to send agents, the state employees, into nursing homes. And in addition to wearing their state oversight hat, they're wearing a federal oversight hat and enforcing federal rules. So through that, money provision, the federal government can tell the state of California how to enforce rules such as visitation policy. But along with all of this, so the feds have their rules, the state has their rules, and the counties are making their rules. And the federal and the state governments have been very deferential to the counties, allowing them to impose or permit visitation restrictions that go beyond what the state and the federal government have, in deference to what they feel the local community is probably the best judge of the conditions in that local community, and probably need discretion to go beyond what they've done in certain situations. So this just creates a lot of confusion, a lot of angles for facilities to kind of make up their own rules. They say we're following this, but we're not going to follow that. And they kind of pick and choose what is working best for them. And I know that's been a sore point throughout the pandemic. This is our new updated visitation fact sheet. This is just one page. We have 2 pages. This is the nursing home page. I put the URL up there at the top. If you just go to CANHR.org and look at our fact sheets, you should be able to find it there. This is up to date. It has a lot of what's going to be in these slides. I just wanted to point it out. If I miss anything, or you need something to pass along to other family members, the fact sheet has been updated. Took me a little while. All right, the stuff I'm going to talk about, here's where we are right now with the rules. At the federal level, we have the memo from CMS, QSO 20-39. It was most recently updated November 12th, I believe. And then since that memo has been released in November, there's been a couple of edits via these frequently asked questions. If you just Google search nursing home visitation FAQs, you'll probably find it. There's been a lot of supplementation of the memo through the frequently asked questions. The DPH, the current DPH all facility letter, AFL stands for all facility letter. That is the document that the department uses to communicate policy changes or policy directives to each individual licensed nursing home in the state. The updated visitation guidance is in AFL 22-7. And in a stroke of synchronicity, the assisted living memo on visitation is also a 22-7, although they put a 0 in front of it. And that's a provider information notice, basically the same substance as what's in the nursing home rules on visitation is in the DSS PIN for assisted living facilities. All right, we'll start with the easy stuff. Although I know for some of you, you're going to say, this isn't easy because I'm having trouble with this, what should be easy. So as of right now, outdoor visits are not only permitted, but they should be available on demand for residents who can tolerate an outdoor visit, assuming the weather's fine, assuming they can get out of their room, get out of the building safely, conveniently, without too much distress. These should be available to all of you anytime, regardless of the visitor's vaccination status. You don't have to show proof of a negative test. All that stuff is, to the extent that it exists, is just for indoor visits now. So if you want an outdoor visit, you should be able to get one of any duration, of any frequency. And then the other supposedly easy one is with a resident in critical condition. And this is what was defined as, or this was the definition of critical condition on the state policy, when death may be imminent. So I had a few questions before the webinar started about hospice, residents on hospice. I don't think for residents on hospice that all of them would be considered to be imminently at death's door. I mean, some people are on hospice for many, many months or years even. But there are some additional protections for visitation with people who are in critical conditions. This one, especially indoor visits are available for unvaccinated visitors, even if they cannot provide proof of a negative test when the resident's in a critical condition. All right, so let's get to the harder stuff. So for indoor visits, we are back to where we were before this, well, I guess it was January 7th, 2022, when the proof of a negative test went worldwide. For indoor visits, if you are vaccinated, if you have proof of vaccination, you should be able to get to visit your loved one or your resident anytime. You don't have to provide proof of a negative test. The one exception is LA County, which is still requiring proof of a negative test for indoor visits, but the criteria expires when there are less than 50 new cases per 100,000 people. And I checked the New York Times database on cases today, and it was under 50. It was 49 yesterday, it's 46 today, and hopefully will continue to trend down. So according to the LA County local rule, you should be able to visit anyone in an assisted living or nursing home if you're vaccinated without proof of a negative test. For people who are not vaccinated, who cannot provide proof of vaccination, there is still a requirement to have proof of a negative test within 24 hours if it's an antigen test, within 48 hours if it's a PCR test, in order to get an indoor visit with your loved one. So once you get in to visit, what other restrictions are available? And this has been a problem for a very, very long time. Duration, frequency, and scheduling. So the classic has been, you can only visit for 30 minutes and you can only get in once a week or once every 2 weeks or once every 10 days, whatever it might be. Lots of limits on the duration and frequency of visits, despite the fact that the federal government eliminated, for the most part, duration and frequency limits back in November 12th. So for many months, we had a situation where California was misaligned with the federal guidance. Federal guidance said no limits on duration and frequency. The state policy was completely unclear on it, and a lot of facilities use that lack of clarity to state that the policy was supportive of duration and frequency limits. And in fact, the state policy up until last week said that 30-minute visits were enough. That's been deleted. So I think on this one, even though it's still not completely clear from the state guidance, I think it's fairly safe to say that the state is aligned with the federal government's November 12th QSO memo that you cannot limit visits by duration or frequency. Now, CMS has given some shading to that through these frequently asked questions, and this is, I put the text in there for you. So if it's an issue of sort of crowd control, and they talked about during the holidays, or maybe there's a peak visitation time, maybe you have a really active facility with lots of visitors between the hours of 4 o'clock and 6 p.m. when people are getting off work and they stop by to visit their loved ones. In a situation where the facility cannot maintain safe social distancing for residents based on the high volume of visitors, during those critical times, there might be a room for some limitations on duration and frequency of visits. But if you read the CMS guidance, I think the expectation is that these will be very rare occurrences. And for the most part, no limits on duration or frequency. The scheduling, I think, is a little more iffy. For instance, if you want an outdoor visit, I think you probably just practically need to give the facility a heads up to have the resident ready to go outdoors, up and at them. I think just scheduling is probably a good idea. And as long as it's not being used to restrict access, I would say go along with whatever scheduling requirements your facilities wants to put in place, as long as they're reasonable and doable. All right, this is a question that we get a lot. The concern is raised a lot. Facilities will say, yeah, we know you're allowed to visit, but at this particular time of the day, on this particular day, we just have too few staff to accommodate all the visits. So we're going to require scheduling, and the scheduling is going to be so unavailable that you will only be able to visit once a week or maybe twice a week at the most, and only for 30 minutes. The bottom line on the staffing concerns is basically that's not good enough. That's not a good enough excuse. In fact, would you mind putting the fact that you don't have enough staff to meet the basic needs of your residents in writing for me so that I can use that in my complaint to the Department of Public Health or the Department of Social Services? So if it's in fact true that you don't have enough staff to meet the needs of the residents, which would include, of course, accommodating robust visitation, which is so important to residents, please put that in writing so that I may share it with the regulators. So this excuse is not legitimate. I can see in certain situations where there's a surge and a bunch of the staff are affected with COVID and they can't come in because they're infectious. Then there might be some legitimacy of the staffing. But if it's just basically we don't pay to have enough staff people here to take care of the residents, that's not going to cut it. All right, for unvaccinated visitors, here's where you stand for the most part. Testing is required. On paper, the policy is clear. Testing is required. You know, the LA exception that I talked about, that's for unvaccinated visitors. So statewide, the policy is the testing is required, and CMS guidance allows the states to require testing. But the CMS guidance also says if the states are going to require testing, the facilities should have to provide it. And there's a lot of problems with this notion. You'll see the DPH guidance. So the bullet points is the DPH guidance. The DPH guidance says nursing home, this is for nursing homes, but it also applies to assisted living facilities. They can offer on-site testing. So it's basically like letting facilities off the hook. And then another place in the all facility letter, it says unvaccinated visitors may only have an outdoor visit. That's strange. Later on, it says if a resident is not able to leave the room or meet visitors outside, the visitation may take place even if you don't have a negative test. So there's some contradiction here. So I asked DPH about what this was all about. And essentially, this is what they told me is in the parenthetical here. They anticipate this to be a rare scenario where the resident's not able to leave the room or meet the visitors outside or be unable to get access to a negative test, or the facility can't provide the test. And I think that's probably right. I think as a visitor who's unvaccinated, who wants an indoor visit, you should probably be demonstrating diligent efforts to get tested if the facility cannot provide the test for you. And likewise, the facility should be providing evidence of its efforts to provide tests, to make tests available to the visitors, and explain why they wouldn't be able to do that. All right, so yeah, then there's a little bit on the LA. LA requires that basically requires the facility to provide the test, and then says if the facility can't provide the test, then the visit should still occur. All right, masking. You had some questions about masking because the latest guidance talks about the residents have to be vaccinated. Do visitors have to wear a mask? The answer is yes, you do. And I think that includes even outdoor visits at this point, which I'm not sure about why, but that's the rule. For residents, CMS says residents do not have to wear a mask. California says residents do have to wear a mask. And I think on this one, because it's not an issue of access to visitation, CMS would defer to the state. CMS would say it's perfectly fine for California to have this additional infection prevention requirement because it's not limiting access. But there are important exemptions to the masking requirements that include residents in the second bullet point. That would be residents with a medical condition that, causes problems with their breathing. So for residents with a tracheostomy, they don't need to be masked. If they can tolerate it, I think that's probably a good idea. But if it's not tolerable, they don't have to wear the mask. And I got the guidance, or the source here is from the DPH director guidance. It's not in the AFL. There's probably should be a reference to it in the AFL and the assisted living PIN. But here's the reference, just so you have it, in case you're getting blowback about having a resident not have to wear a mask. Okay, the always difficult issue of roommates. This goes way beyond just the visitation problem. There's always issues with roommates in long-term care facilities. But on the roommates, the consensus is try to avoid having the roommate present. And that would be probably the first option, is to get the resident out of the room, which I think is just sort of probably good for their quality of life anyway. Get them out of the room as much as possible. Get them outside if you can, maybe in a common area. If the resident that you're visiting, it's not convenient for them to get out of the room, then maybe the roommate could be moved out of the room for a while. Again, they may benefit from getting out of the room as much as possible. If you can't get the visitor, the visitee, the resident you're visiting, out of the room, and you can't get the roommate out of the room, may want to consider a room change to better accommodate visitation. But if you can't, you can still have the visit. So it's kind of a last resort, but it's an available resort for folks to have in-room visits with the roommate present as long as social distancing can be maintained. And I've been in pretty much the tightest nursing home rooms probably in the state, 4-bed rooms. And I still think you can find pockets where you're 6 feet away from the other residents. I don't think that's going to be a big problem. And now the problem might be when you have each roommate is being visited and you've got multiple visitors in the room for different residents. That may be a problem where you can't maintain the social distancing. Okay, another big problem. This came up a lot during Omicron. Hey, the facility has an outbreak. We are locking it down. There is no visitors allowed. I've got a couple pictures on my phone that people sent me, signs all over the door saying, COVID outbreak, no visitation, visitation shut down. That is illegal. Facilities cannot shut down visitation during an outbreak unless there is an order, not a recommendation, but an order from the government, which is usually going to come from the county level, to shut down visitation. I don't think I've seen an order from a county shutting down visitation during an outbreak. They may exist, but I've not seen one. I've seen in some cases recommendations from the county to pause visitation. But when we're talking about federal and state laws guaranteeing access to visitation, those recommendations aren't going to give you an excuse to avoid following the law. It's got to be an order that breaks that requirement to allow visitation. And you'll see there are some, the quotes are from CMS. Visitation must still be allowed, but there's certain considerations that may come up where the facility may be required to implement additional restrictions, and in some cases maybe keep visitors out, but that's going to come from the local health authorities. And it's not going to be a recommendation, it's going to have to be an order. And the state's position on this, I think, is pretty clear now. I've had many discussions with them about it. If there's an outbreak, the facility can pause visitation, but it's just for a very limited time to get the residents and staff tested and cohorted according to their COVID status. It's not a permanent thing like, oh, we're shutting down for 3 days in order to protect our residents. No, it's a very procedural based. You follow your procedures for testing, cohorting, and as soon as that's over, visitation commences again. So for issues of compliance, and I know, trust me, everybody out there, I know there are significant concerns about compliance. It is the wild, wild west. It is a state of anarchy in some situations related to visitation, and there's not been a whole lot of enforcement happening on these rules. But in my experience, and I'm more and more experience every month on filing complaints, I've had good results. What I've started to do now is any complaint that I file, and I do it in writing every time, I ask that it be treated as a priority 1 complaint. And that means get somebody out there today or tomorrow. Get a surveyor, get an investigator in the building as soon as possible, because this is an issue of critical importance for residents. If it's a total lockout, none of the residents are getting visited, that is an awful situation. That is an obvious situation that threatens the health and the welfare of those residents. The state should be out there immediately to make sure that the visitors' rights are not being violated, that the guidance is not being violated. And I've had facilities have to reopen their visitation. I had 2 instances in late January where facilities went into lockdown. I filed a complaint. The next day, they were reopened for visitation. So this is the way to go. And if you have issues with the state not responding very quickly or unsatisfactorily, those are the kinds of things that you should let me know. I invite you to let me know. You just call CANHR, ask for Tony, send me an email, tony@canhr.org. Just call our general line and ask for an advocate. All of our advocates are prepared to help you all through your visitation concerns. I think that might be it. I'm not going to do that quite yet. Of my Essential Caregiver Coalition friends, anything that you want to add here? I'm sure there's got to be some stuff. Are you on mute, or are you just processing all of my incredible information?
I think Tony, it's Melody. Just processing, a lot. It's excellent information, and it will be excellent resource information as well. And I think in our Facebook groups and other communication we get, we are hearing just so much about inconsistencies in visits. Yesterday, someone had reported a friend of hers, a husband is in hospice, and they are looking at not many days left, but the facility told her she couldn't come in. So I responded back and said, call the ombudsman, call licensing oversight, and call CANHR. So, those things are still going on. So it's good to continue just to keep getting the information, a lot, because in a time of being upset and in a time of crisis and trying to get in to see a loved one, especially if it's not good, not a good status, you don't remember those things. So it's good to have those resources. I really appreciate that and having it to pass on to others.
Yeah, let me address the hospice issue because we had a couple questions about it. Like I said before, if it's the demise is imminent, you have this extraordinary access compared to other people to get inside and have your visits. If it's someone whose death is not expected, I would say in the next 2 weeks or something, I still think you should have robust access. And there are some provisions in the state and federal guidance that talk about residents who have some extra critical care needs and are getting extra support from their visitors to having more angles. At this point, though, I think the access should be so broad that you don't need to rely on that, but it does strengthen your case if there are unreasonable or illegal restrictions being placed. And so in addition to calling the licensing agency and the ombudsman and CANHR, I would also be calling the news stations, because I think that's a newsworthy deprivation of rights. And the facility should probably be subjected to the public glare of locking out visitors who are providing support to somebody on hospice. Another question we got was about Ombudsman Visitation. And I can't believe that we're still having trouble with this, but Ombudsman should have full access, 24-hour access to go into a facility and see residents, to check in on residents, to fulfill appointments with residents who have asked for help. That is no bueno, keeping an ombudsperson out for any reason, unless there is an order, allowing a lockout or imposing a lockout on visitation. And again, I think that those are very rare, if they ever occur at all. And then we also had a few questions about outings for residents, and the rule on that has been pretty much the same for at least a year, I would say. Residents are allowed to go on outings, and this was one of the problems with the visitation policy we had for a long time where visitors couldn't come into the building because we're worried about COVID, but residents could go out of the building and go to NBA games and sit next to 20,000 people and then go in and there's no quarantine, no isolation period. And I'm not saying take that away. I'm glad residents are able to go out, but it was this real strong distinction. There's been no changes as far as I know related to residents' ability to go in and out. They can go on outings as much as they want. Of course, you want them to adhere to good infection control protocols. I wouldn't recommend going to NBA games, and definitely going unmasked to NBA games or Super Bowls for that matter. I saw a lot of non-compliance with masking mandates at the Super Bowl. So you want them to follow good infection control protocols and not, take on known exposures. But other than that, they can come and go. Anything else? Miko, anything?
I was going to add, thank you. That was an excellent presentation and really easily digestible, which I think is important. I can tell you that California is not the only state dealing with this. This is happening in every single state, and every single state is still sliding around in terms of what CMS has said, what the state says, what the facilities say. And the key thing to know, and Tony, you made an incredibly good point, is first of all, you have to know the rules. And most of the time, you're going to know the rules better than the person you're talking to in the facility if you educate yourself. And CANHR is a fantastic place to do that. The point that Tony made that I think doesn't get driven home enough is that when it comes to outbreak, putting a flyer on the door and shutting it and saying we are in outbreak status, you can't come in, isn't actually real unless there is a government order. And I know, actually my father is in the state of New York, and they were doing that before COVID. They would tell everybody they were in a flu outbreak, and they would tell everybody that they couldn't come into the facility. And really, in a lot of times, the facilities are banking on the fact that you don't know what the actual rules are. So the number one thing you can do is to educate yourself as best as you can and walk in there with the rules in your hand if you have to. And that you actually are a lot more powerful than you realize.
Yeah, print them out. Print them out and bring them if you have to, and bring our fact sheet as well. Those are all great points. Thanks, Miko. Oops. All right, so I'm going to ask Liz Fuller to unmute. If I can.
Hi.
Okay. Hi, Liz. Are you there?
I am. Can you hear me?
Yeah, we can hear you.
All right, great.
So I'm going to advance to this next slide, which is sort of our breaking news moment. This is very exciting. I got to tell you, I was almost reduced to tears a couple weeks ago when I got the news that there will be state legislation to help us off this visitation roller coaster to some extent. Liz, can you tell us a little bit about it?
I can. We have the language in and ready to take to the desk. It's, a lot of us are working virtually still, so there is some delay there. I wish I could give you a bill number, but I don't have one yet, but know that there will be one coming. I know that Tony can get that out to the greater audience here. But essentially what we're looking is for parity, and I represent the Aging and Long-Term Care Committee. I'm the chief consultant there, but I can also say that visitation has been an issue that I've been working with or working as a topic for the last couple of years, and recognizing that we needed to find something that was going to be that really is coming from everyone's direction. And this is to make very, very clear guidelines. I'm not representing facilities, but I did have a conversation with facilities when we intended to introduce this bill, and had some of the most productive feedback, because I do have to say that I think anyone who's had to deal with the dearth of the all facilities letters during this pandemic, no one can make sense of any of it. But I think that if we are very, very clear that with these designated support people, they cannot be held to any higher standard. It is designating two designated support people. And I had some great feedback from facilities about some questions relating to who designates, what happens if someone is unable to make that designation for themselves. Would we want to have a statewide registry where they would be on there and they could upload their testing if we're still in a space for testing? So I think that we have a lot of productive feedback. And I think this is something that as we're moving forward, we can see support from everyone involved. That's the family members, those are the residents, and those are the facilities who are tasked with keeping current to all of the up-to-date guidelines. And so I'm really, really hopeful moving this measure forward. Again, I don't have a bill number for you, but I'm happy to answer any questions if you have.
Yeah, thanks, Liz. And do you want to mention who the author of the bill will be?
Oh, I'm sorry. The chair of the Aging and Long-Term Care Committee is Adrien Nazarian, and he will be authoring the bill.
Yeah, so this is super exciting. I think we probably needed this bill last year, but there was a lot going on with nursing home reform legislation, and it didn't get picked up. And it only got the need for it only became greater over the course of 2021. And I'm just so happy to have something, because I think there will be, as there's been in other states, overwhelmingly there'll be overwhelming public support in favor of this, in favor of making sure that families are not completely disconnected during a public health emergency, when those connections are more important than they've ever been. We have some sort of guarantee that they will be preserved for the most important people in the residents' lives. And I know that legislation is always a bit of a roller coaster itself. There will be lots of people with lots of opinions about how this bill should look, but I'm pretty confident that ultimately we will have something that will protect these relationships during public health emergencies that we didn't have prior to the pandemic and we very much needed. So thank you so much, Liz, for your work and helping put this together, and definitely to Assembly Member Nazarian for agreeing to author it. And everybody, we will be sending out plenty of alerts as the legislation goes through the process about how to support it and have your voice heard at Sacramento. All right, Maura, is there any questions that you think I should?
Yeah, definitely. So going back, this is regarding the kind of staffing levels. And so a question about that was, what if a facility has an approved staff waiver?
Oh, well, the staff waiver, I mean, and staff waivers only exist in the nursing home world, and they're usually regarding the composition of the staff as opposed to the amount of staff. CNAs versus licensed nurses. So waivers should have nothing to do with access to visitation. So if a facility is claiming, we have a visitation, we have a staffing waiver, therefore we can have fewer staff than are available to meet the needs of the residents, that would be a blatantly illegally understaffed facility, and the visitation restriction would be illegal as well. So waivers should not impact visitation access at all.
Thank you. And then there was a question about whether tests have to be PCR.
What was the question, Maura?
Whether the tests for visitors, I believe this is for unvaccinated visitors, if they have to be PCR tests or if home tests or antigen tests are still allowed.
Yeah, they do not have to be PCR tests. What a PCR test gets you is an additional day between the taking of the test and the day you make your visit. So it's 48 hours between the testing for PCR and the time of your visit. You got a 48-hour window. With antigen tests, still completely available, but you only have a 24-hour window. And I'm interested to know if Melody, Madeley, Miko, if you have any experience or reports from people about getting the test. But what I learned when the mass testing requirement was in effect for regardless of vaccination status, it basically meant you had to bring your test to the facility because an antigen test. PCR test results were taking far longer than 48 hours to get. And the facility staff, they didn't really have a way of verifying the legitimacy of an antigen test that was taken 24 hours ago. So you take a picture of your negative results. Do you upload it? I think there's ways of doing that, but maybe the facility isn't dialed in to verifying. So I think most of the facilities were requiring you to bring your test in, or they were providing the test, and they would literally have a staff person watch you take it and sit there for 15 minutes while the results came back. Was anything did you want to add to that, my co-presenters here?
I think that was pretty much the experience and feedback that I've heard it from some of our membership, as well as personal experience going visiting at friends at a skilled nursing facility, where there was, definitely some hard proof that the test was done and negative, or they were administering the rapid tests. And there was usually an area, at least the facility that I visit, there was an area outdoors where the test was administered, and one of the staff was monitoring and taking all the screening paperwork and so forth before being allowed to enter the building.
Any other questions, Maura?
Yes. Is there a requirement on the type of mask that visitors or a resident must wear? So do they have to wear cloth, surgical, or N95 or KN95?
That is a good question. I'm just going from memory here. I think the requirements are basically a well-fitting mask. It is not a requirement for a KN95 or N95. There are certain situations where those particular masks are required, and I think it is the situation where it is an unvaccinated visitor wanting a visit without proof of a negative test. I think in that situation, to get the visit, you're going to have that particular kind of mask. But other than that, I think it's just well-fitting. Of course, I think all the recommendations from everybody now are to wear the KN95s or the N95s every time, but it's not a requirement in most situations.
Okay. In regards to outbreaks and the discussion of how facilities are allowed to temporarily shut down or shut down for a short duration, there's a question about what is short duration, a facility's definition versus a family definition of what a short duration, what would be an allowable amount of time? Yeah.
I don't know the answer to that. My guess would be something less than 24 hours. And at the beginning of the pandemic, every facility in the country every nursing home in the country was sent a rapid test machine. They should all have an ample supply of test kits they're all required to do routine testing of staff, some level of frequent testing of staff. So they should all have kits. So providing the test should be pretty quick. Cohorting, that might take some hours. You're explaining to a resident, maybe they've had this roommate for potentially months or years even, and they're going to have to move for cohorting. I think that should be done with some level of sensitivity as opposed to let's go get in this other room. So cohorting may take a while, but I wouldn't think that it would need to last for more than a day.
Okay. There was a question of whether or not DPH can be sued for negligence.
If they could be, we would have done it. How about that answer?
Yeah, I think.
So I think the answer is no, generally no. Yeah, we're always thinking about that.
And then there are a couple questions in regards to the new legislation about if there are thoughts right now about how support people would be designated, if it would be by the resident who makes that designation or the decision maker.
Yeah, as Liz alluded to, I think there's going to be some lots of discussion about that. Yeah, you want to take that, Liz?
As it's written, or as our intention is, it's the designees are done by the individual who lives in the facility. unless they are not able to make decisions for themselves, then that decision would fall to the person who is designated to make decisions for them. It is not something that the facility can make on behalf of the resident, nor is it something that we would allow Department of Public Health to do.
Okay. And then is the language for the bill posted anywhere at this point, or is it still kind of draft? No, it's not. Okay, not yet.
Yeah, it's based on HR 3733, which is the bill in front of Congress. It's not all that long. We tried to keep it pretty simple. It should be posted probably by the end of the week, Liz.
It will be, yes.
Okay.
Thank you.
Yeah, once we have the bill number, and then it usually takes a day or two to get it up on the legislative website. We will, of course, be sharing all the information that we can about the bill. I also want to mention on who designates the support person. There is no way that we are going to be able to write a bill that makes everybody peaceably agree who the two designated support persons are going to be. There are going to be families that fight over everything, and this is going to be one thing that they fight over. The unfortunate reality is that a lot of residents will probably not have capacity to make affirmative designations of support persons. It's going to default to whoever's been making their healthcare decisions up to that point. And California continues to have a paucity, a vacuum of law on default surrogate decision making. So if there's no POA agent, now you're left with family members who are equally authorized or unauthorized to make healthcare decisions, and they're going to fight. But I think that's going to be a very small minority of the cases. And I think the good news is that for the vast majority of residents and their families, there's going to be an availability for two designated support persons. There will be a small sliver of people where there's going to be fights over that. And I don't think that that's something that we can really deal with 100% in the legislation. It's just going to be one of those things where we do our best, and then maybe some of these people end up in court, unfortunately.
Tony, can I address sorry.
No, you're good. Go ahead.
I was going to address one of the comments in the chat about HR 3733, and I'll just give a little bit of overview so that people know what that is. So the Essential Caregivers Act, which is a federal bill, and it's also known as HR 3733, which has been introduced to the House. It was introduced in June. And this is not a new law at all. What this is that it is defining what already exists. So right now, just to give you a little bit of backstory, there's something called the Nursing Home Reform Act of 1987. And in that act, it was noted that residents of long-term care facilities that fall under the Centers for Medicare and Medicaid Services, CMS, have the right, the fundamental right to have visitation 24 hours a day, 7 days a week, okay? But then when the pandemic hit, there was something called the 1135 waiver that went into place through Health and Human Services, which is, if you look at it in an organizational chart, they are above CMS. And they basically said, because of this waiver, you are able to give states the ability to waive visitation. And the waiver also creates situations during times of public emergency. For example, when New York City was in meltdown, they of course were allowed to put tents in their parking lots and make them a pop-up hospital, right? So we need these laws, they're important. But at the same time, it's kind of a blanket approach. And that's how here we are 2 years after a lockdown and still fighting about these things. So what the Essential Caregivers Act does at the federal level, so that means skilled nursing facilities, right, would comply. And every resident in a long-term care, skilled nursing facility and other facilities that fall under CMS are able to designate two support people. And it's just like Tony said, it was specifically written so that the power is to the person who is the resident, not to the facility, to choose who that is. And then those two people have up to 12 hours access a day to the person living in the facility, and they will be tested and PPE equipped as staff. That's how it's written today, that they are equipped the same as staff, so that we are reducing all public safety issues in theory. Now, there's a comment in the chat about loopholes in the federal bill. What I will tell you is there are loopholes in every bill. So the reality is the people who wrote this bill, and this is the most important thing to note, is that it was the families, it was the caregivers who wrote the language, and doing that with the advocates, getting buy-in from people who've been leading this charge, and not necessarily the lawmakers, so that we're living this, right? Like, we know what's happening when you go into a facility and now they've changed the rules again, and you have to sign in, and you've already been there 29 minutes, and now you can't have another visit, or whatever the baloney is that they're throwing at us. So we tried to write this as tight as possible. And Tony makes a really good point when it comes to legislation. And this is where we're at now, which is you do the best that you can, you put forth the best that you can in terms of writing in everything that will protect the rights of the most vulnerable, our loved ones. And then you fight like hell to get somebody to sign on and support it. And just because somebody supports it doesn't mean this is the end all be all. This is actually just the beginning for the California state bill, for the federal bill. And that's why all of your voices are so important, and that you have to come to these conversations and say, you know what, I see a hole here, and here's how I see it. And so then we talk about it, right? Because it's not just a one and done, it's a living, breathing thing that we're trying to put together. And there are many, many voices at the table. So are there loopholes? Yeah. But can we work to make this as tight as we can going forward? Because we're all fighting for the most vulnerable voice. Absolutely. And that's why we need your help.
Yeah, well said. Yeah, every bill has problems. You can never think of every exigency that might exist, or exception that might come up or be requested. And then of course there's the issue of enforcement. We can have great rules, but if no one's, meting out punishment for violating them, then they just get broken all the time. But I sure know that we could have used something in 2020, 2021, and even up through 2022, something stronger than what we've had. We've been at the complete discretion and the mercy of public health people who oftentimes don't know nursing homes from a hole in the ground. They've never dealt with long-term care. All they think are in terms of epidemiology and case rates. And they're not thinking about quality of life and what it's like to have to feed a loved one who won't eat the facility food. So this is significant progress, and we're thrilled about it. And but that said, we welcome all input on the bill, and what your thoughts are in terms of making it stronger and more usable, more practical, and more enforceable.
Tony, we have another question about, so we've gone over the information regarding skilled nursing facilities and residential care facilities. Is there any change in visitation for hospital, for those individuals that are in a hospital?
No, the answer is no. Not that I've seen. Hospitals were amazingly exempt from the testing requirement that went into effect in early January. I still don't know why. But I think hospitals are kind of, doing their own thing in terms of, some hospitals have different rules than others. I know my father-in-law's been in and out of the hospital quite a bit lately, and this hospital imposed a rule that he can only have one designated visitor, and that's the person who visits him throughout the course of his stay in the hospital, and no other visitors are allowed. I'm not sure if that's legal. I just don't know the hospital rule that well, and there's been no changes that I know of.
Okay. So we're coming to the last 5 minutes of this event, and thank you everyone for spending your time with us, but wanted to see if there's any last comments from Tony or the other panelists.
No, I would say if there was any questions that you had that didn't get answered, or you have a horrible case you want to talk about, I encourage you to give CANHR a call, or give me a call, send an email. I'm happy to try to help. But I think no one will be upset if we end a couple minutes early. Well, not too many people.
I just on a note, and I did put something in chat as well, because so much of the advocacy and so forth certainly was kind of tapped off by COVID and focuses around COVID. But the truth is, with both of the bills, with the state bill and also with the national bill, that even if COVID and all its variants, just we blink our eyes and it's all gone in the next 30 seconds, we still need these bills in place. We still need legislators to be contacted. We still need to, have the media help us get the information out there, because there will always be other reasons for lockdown. There's also a precedence right now as to how to do lockdown. It could even be, in past years, those of us who had loved ones in some form of long-term care, sometimes those facilities would even lock down for a seasonal flu. They may have had an outbreak, and even though it's for a few days, for some that can be manageable, but for a lot of others, that's detrimental. So we need to keep that in mind and focus as we're advocating for these bills to go into law, that it's not just I think as or a them thing or an us thing. It's, it covers for the future as well.
All right, well, thanks everybody for joining us. May you have abundant access to visitation going forward, and if you don't, let us know. Take care.
Thank you, everyone. Have a great afternoon.
Thanks, everyone.